Hi, I'm Judy Klein, president of Unity Consortium, and delighted to welcome you to today's Adolescent Immunization Action Week dialogue on countering vaccine misinformation and building trust together. According to Unity's recent research, parents and teens rate vaccination as less important than many other preventative health activities like wearing seatbelts, going to the dentist, and even taking part in family meals. Why is this the case? We know parents have more questions than ever about vaccines, and about half are concerned about vaccine safety and efficacy based on what they're reading on social media. And more than 8 in 10 agree that there's a lot of misinformation out there. And distrust is even greater for parents and young people who are living in rural geographies or certain regions of the United States. So it's imperative that we make science-based vaccine information engaging and accessible to all so that they can make sound vaccination decisions for their family. Until recently, a small number of individuals have been responsible for originating and propagating misinformation. But now we have government and public health leaders advancing misinformation. Dr. Peter Marks, who led the Vaccine Center at FDA, wrote in his recent resignation letter, and I quote, "It's become clear that truth and transparency are not desired by the secretary, but rather he wishes subservient confirmation of his misinformation and lies. My hope is that during the coming years, the unprecedented assault on scientific truth that has adversely impacted public health in our nation comes to an end, so that citizens of our country can fully benefit from the breadth of advances in medical science." Let's now turn to trusted people to hear their thoughts on the importance of vaccines for adolescents and young people. Please don't hesitate to ask your questions or share comments in the Q&A. So first, Dr. Joelle Burvell is known as the medical mythbuster and uses social media to address racial disparities and biases in healthcare. He has over 1.3 million followers. Joel has served on the White House's Healthcare Leaders in Social Media and the Council for Responsible Social Media. He's been recognized as a 2025 Forbes 30 Under 30 in Social Media, 2024 TED Fellow, Smithsonian Channel Cycle Breaker, Scientific American Revolutionary, and more. Dr. Alison Buttenheim is a professor of nursing and health policy and scientific director for the Center of Health Incentives and Behavioral Economics at the University of Pennsylvania. Her research focuses on behavior change, challenges in public and global health. Using behavioral economics, Alison focuses on innovative interventions to prevent and mitigate infectious diseases. She's a recognized global expert on vaccine access, behavior, confidence, and demand. And Dr. Céline Gounder is a senior fellow at Kaiser Family Foundation and the editor-at-large for public health at Kaiser Family Foundation Health News. She's a medical contributor on CBS News and has written for the New York Times, the New Yorker, the Atlantic, the Washington Post, and more. She's known for her coverage of disinformation epidemics. Celine's a clinical associate professor at NYU's Grossman School of Medicine and cares for patients at Bellevue Hospital. She was elected to the National Academy of Medicine and received the Research America Meeting the Moment for Public Health Award. Wow. And now let's welcome our wonderful moderator and longtime and appreciated Unity partner, Dr. Chelsea Clinton. Chelsea's a passionate advocate for public health, working to improve global health and wellness through her role as vice chair of the Clinton Foundation. Chelsea also serves as vice chair of the Clinton Health Access Initiative and uses her platform to increase awareness around issues such as vaccine hesitancy, childhood obesity, and health equity. She's a mom of 3, teaches at Columbia University's Mailman School of Public Health, and the co-founder of Metrodora Ventures. Dr. Clinton.
Oh gosh, well, Judy, thank you for that far too generous and long introduction. And it's always wonderful to be with you, particularly in this week. And it's great to be with people I admire and some I'm lucky enough to call friends. So really, just Judy, a huge thank you once again to Unity for convening us and having an indefatigable focus kind of on this area, and particularly how the area of vaccine hesitancy and its cousins, vaccine mis and disinformation, particularly negatively affect kids and especially adolescents. So really, Judy, just thank you to you. I really want to just jump right into the conversation and an open question for all three of you, but Joelle, maybe we'll start with you just because you were introduced first. So we'll have you kind of first up to bat. Judy shared kind of the recent research from Unity, which I know probably isn't surprising to all of us, and yet to be presumptuous for a moment, I'm sure is distressing to each of us. And wonder, Joelle, if you can just reflect on kind of what you think are the greatest risks, particularly for adolescents right now. And how do you kind of think we're doing in trying to reach adolescents, teenagers, people in their early 20s, kind of in this conversation to equip them with kind of good evidence-based information? And then maybe after we'll go to Alison and then to Céline.
Yeah, absolutely. Well, first of all, thank you so much for having me here. I think this is such an important conversation, especially in today's day and age, as was highlighted at the top of the conversation. But for me, I think about the fact that young people are growing up in an age where their first exposure to health information is often TikTok, YouTube, Instagram, and not a doctor's office, which for many of us, that was our first exposure. They're digital natives, but that doesn't make them immune from misinformation. And if anything, that makes them more vulnerable to it because the content online can feel very authentic, or can feel rebellious in some ways and overriding scientific accuracy. And so what that results in is what we talked about at the top: declining vaccine uptake, delayed care, growing skepticism of the systems that were created to protect them. So I say all that to show how social media is really changing the landscape of how we need to be talking about vaccine misinformation, and really addressing it more directly. I think we haven't done enough right now in terms of finding ways to reach young people, especially online, to make sure they're getting accurate information. First place they're getting, if the first place they're getting it is from online information, how do we make sure that we're putting more accurate information when it comes to vaccines online, so that the first thing they see is correct information, not misinformation, which makes it harder later down the line to correct. So at the end of the day, vaccine misinformation has really evolved from fringe skepticism into a full-blown ecosystem of doubt that's been fueled by algorithms, mistrust in institutions. It's figuring out how do we make sure we regain that trust, especially for young people.
Great. Thank you so much, Joelle. Alison?
Yeah, building on what Joelle said, all of those factors. I'll also throw in, I think we haven't done a great job like sharing the amazing good news of the adolescent schedule. Little kids are in the doctor's office a lot. Their parents hear a lot about the immunization schedule. They get a lot of shots. And then there's this transition to adolescence where the fact that we have Tdap, meningococcal, HPV, those are amazing vaccines. Flu and COVID on top of that. But the adolescents are in care less, and they're starting to think about making their own decisions about healthcare. And we're kind of missing that handoff, I think, for adolescents. And the second thing I'll touch on, which Joelle also touched on, is how much polarization and politicization we had of vaccines coming out of the COVID pandemic. It was there before. It's not totally new, but the tenor and extent of it is just another source of friction in the system in delivering vaccination services to adolescents.
Céline?
Yeah, I will say we've had some perhaps good news this week. My colleague, Dr. John Lepuc, interviewed RFK Jr. For CBS News, and RFK, who, as we all know, is a longtime vaccine skeptic, did acknowledge that he recommends the measles vaccine to help control the current measles outbreaks that we're seeing in West Texas and elsewhere. I would say it was still a somewhat lukewarm, tepid endorsement. And as my colleague John pushed him on that, said you need to be out there a lot stronger advocating for this. I would also just note a couple issues with Kennedy's comments, however, and it's part of sort of continuing the myth that there's not enough data. So he said, well, you know, these vaccines were only tested for 3 to 4 days without placebos. Those comments are really misleading. Maybe he was confusing phase 3 and 4 trials for 3 to 4 days, but in a phase 3 or 4 trial, you're talking about people being followed for years, if not in the case of phase 4, decades. So we have lots of follow-up data. And in terms of placebos, well, the first measles vaccine were licensed in, the first measles vaccine was licensed in 1963, and that was long before we had sort of the modern clinical trial standards. And at the time, placebo-controlled randomized controlled trials were not the norm. So they were tested based on what was the gold standard at the time. And there were some control groups in some of those studies. So yeah, it's not how you would do it today, but I guarantee you, if we had a measles vaccine come out today, it would undergo that kind of testing with placebo controlled. And to say that, you know, that's the only way, it's sort of like saying, well, I have a patient with appendicitis. We're going to do a randomized placebo controlled trial of no surgery and no antibiotics versus standard of care treatment, which is better. Well, you know, that trial was never done. That doesn't mean that that's the way we should be doing things now. That's simply unethical. And just finally touching a little bit on what Alison was saying, I think it is a very difficult time politically. I think we are a country that has a very strong libertarian bent, and that's what you're seeing with a lot of RFK's comments. And unfortunately, libertarian public health is an oxymoron. Public health is about how do you balance the individual and the community, and sometimes that does mean that the individual has to do things on behalf of the community. And how can we have a conversation about that that's productive? I think is a real challenge in this moment.
You know, I also, Céline, like think reflecting on all three of your comments, and really back to kind of Joelle, acknowledging, you know, what isn't just a truth, but now a truism that so often young people's first brush with anything is on social media. I mean, not as it just relates to kind of vaccines or their health broadly, but kind of so much of what we all learned kind of either in doctor's offices or in faith communities or with our parents or grandparents or also in schools, you know, that I really wish, and Alison and I have talked about this before, that we did a better job of like teaching about vaccines in like high school biology. I also wish that we taught civics kind of to help kind of have the grounding, Céline, of all the ways in which we actually make trade-offs and choices kind of for the better collective good, not only as it relates to public health, but kind of just the public more holistically. You know, I wonder though, Alison, if I can turn to you and pose this question first, and then of course, Joelle and Céline, hope that you'll comment, which is that, you know, as a behavioral scientist and someone who I know spent a lot of time trying to work with not only your colleagues, you know, in Philadelphia, but around the country on how to help kind of pre-inoculate against vaccine misinformation during COVID, but also to ameliorate it. How much of that work with your behavioral science kind of like, you know, glasses on, do you think is relevant to how we try to talk about all vaccines? Or do you think there was something kind of particular about that vaccine? And do you think it's relevant to how we think about empowering adolescents with kind of good information to make the right choices for themselves and their community? Or do you think it's really kind of more for older adults?
Great question. So Chelsea is referring to an approach that you know, Joelle's work touches on too, where instead of trying to debunk misinformation after it comes your way, we try to pre-bunk. And it's interesting, it's actually a vaccine analogy. So we inoculate you against misinformation. We give you a weakened dose of it. We tell you people are trying to fool you. Here's what that looks like. Here's the facts they might try to, you know, persuade you about, or here's the strategies or techniques they might use. Recognize this when it comes your way. And it's particularly helpful if opinions and attitudes haven't been formed yet. It's great to sort of get out ahead of it. So it's really effective for like new vaccines that we don't even have yet. I'm doing some work on this for the HIV vaccine, which we don't have, but it's going to come and the misinformation will come. But what I really like about it for teens and adolescents is it's also really like skills building and empowering. This is not trying to nudge you or fool you or, you know, hard persuade you about something. It's trying to give you the power to recognize that misinformation is everywhere and there are ways to kind of build resistance against it. So It was helpful with COVID. I think it will be helpful for new vaccines coming down the road, but also helpful for people who are just kind of moving into this space of starting to form opinions about vaccines or anything else. So a lot of research, more research needs to be done about it. There's some nuanced results and nuanced ways to do it and to scale it. But I think it's a really promising approach.
Well, I see you nodding a lot, so please jump in.
Yeah, I feel like this is a lot of the work I try and do on social media right now. One of the biggest lessons I've learned is that facts alone don't change minds, especially when people feel unheard, when they feel unseen, or especially when it comes to historically marginalized groups. And so I've tried to move, I'm the medical myth buster, but I've tried to move away from the reactive myth busting, just correcting the falsehoods after they spread, to doing exactly what Allison said, the pre-bunking. And I try and frame it like when you think about an email that you get that you don't know if it's real or fake. It's a scam email. But if you know the red flags, look at the email chain where it came from, look at the language, are there a lot of spelling mistakes? You're going to be less likely to fall for it. And so to do that on social media, I focus and try and show in even my videos about how misinformation is actually working, whether that's pointing out emotional manipulation, the misuse of scientific language, which RFK has been doing a lot recently, or if it comes to like appeals to personal freedom. And so trying to figure out what is a deeper agenda that someone can be having. And then at the same time, though, I layer that with storytelling because, like I said, data doesn't live in a vacuum. And so I try and tell stories about historical moments in medicine that show why the mistrust exists in the first place. So I have a whole series called Hidden Medical History. And oftentimes, a lot of physicians will say, do you think you're creating more fear within communities? And I think for me, it's building trust to let people know we know this has happened before. Here's how we're not doing it again, especially when it comes to Black communities where there's been unethical experimentations. Then I also try and pivot to stories of resilience, so thinking about community care and how are people reclaiming their power through informed choices. And by focusing on representation, I think you don't just be a messenger, but you really showcase your community why this matters to you and why this is something that they can trust as well. And there is, I think, the one thing that we don't do enough about, and we started doing this later in the COVID pandemic, but it's really addressing the uncertainty too, letting people know that science evolves. That's not a flaw of science. That's actually the strength of it. And that when we don't have all the answers all the time. So I try and focus on transparency too, to say, here's what we know right now. Here's what we're still learning. And here's how you can stay informed about where we're going with this. I think that of humility goes a long way in building credibility, along with all the pre-bunking to make sure people understand that the conversation is growing and we're all a part of it at the same time.
Céline?
Yeah, I mean, I agree with everything Allison and Joel have said. The one thing I would add is this is so much a conversation that is not about information, whether frankly it's pre-bunking or debunking. It's really about showing curiosity in someone else and showing that you care and that you have their best interests at heart. That's what people really want to see. And I will tell you, when I've had these challenging conversations, that's where I focus my efforts. I don't even really spend too much time talking about the vaccines. And very often the patient or whomever it is I'm talking to, the reaction will be, wait, I thought you were going to try to convince me to get this vaccine. And then they might ask me a question or two. And it actually works way better that way, that I've spent time just talking about them and how things are going and, what the pandemic meant for them and their family. And, these things that are frankly for them more top of mind. And then that's the way you can kind of shift the conversation and shift the emotion. So much of this is an emotional conversation.
I'm curious, Céline and Joelle and Allison, were you taught how to do that in medical school or nursing school?
No, a lot of what I learned was from, so as Chelsea knows, earlier part of my career was spent working on TB and HIV and with PEPFAR programs in Southern Africa. And, when you're working with people who may not have gone to much of any formal education, where there is huge reason to mistrust somebody from a completely different country, much less, not your race or your culture or anything, maybe not even your language. How do you explain things in a super accessible way? And how do you, even if you try to explain, sometimes somebody who's only had maybe no elementary schooling, that's really not going to be what resonates for them. What's going to resonate is, I care about you. And I think this is what I would do if it were my family, and here's how I'm going to demonstrate that I care. I think that's how, honestly, I learned some of these skills.
I'm curious, a question for all of you, and maybe, Joel, again, we'll just, start with you and then go to Allison and Céline. Clearly, as already been acknowledged, we're in the midst of a growing measles outbreak. And yes, I agree with your characterization, Céline, that like RFK Jr. sort of tepidly, I think was the word you used, endorsed the vaccine. And there's, at least in the coverage I've seen, been a lot of reporting on how families are feeling, particularly in West Texas, kind of still the epicenter of the outbreak, how providers are feeling, how community leaders are feeling, how kind of public health officers are feeling. But as I was just sitting here thinking, I don't think I've seen any interviews with how adolescents in these communities are feeling. How do you think kind of we collectively do a better job of ensuring that adolescents are included kind of in any conversation, but particularly kind of urgent, timely ones like this? And how do you think about in your own work, including adolescents? And maybe Joel, will start with you, and then I can go to Allison and Céline.
Yeah, I love that question and that point that you just made, that often youth are not involved in the same conversation, especially when things are affecting them the most. I think I always say that young people in these communities aren't just the passive recipients of information. Young people are the connectors, they're the translators, they're the leaders, and they're already doing the work of educating their peers, whether it's countering misinformation in their group chats, right? Or asking the tough questions in classrooms to their teachers and at home. I think if we're able to really equip them with culturally relevant, accurate, empowering information delivered in ways that speaks to their experience, in the ways that they're talking with their trusted peers, they become the most trusted and powerful messengers that we have. I think there's so many ways that we can be doing that through programs like this, right? Through making sure that we include students when we're talking with physicians, through holding roundtables, or going directly to those communities and asking them how they feel. I think listening sessions are so important. But that means shifting the approach from educating to co-creating. And in order to do that, we need to be investing not just in hospitals, but community-based health education programs that are beyond kind of the medical sphere. So that's looking at schools, churches, barbershops, TikTok feeds like I do, or other programs as well. And I 100% agree. I've always said, I think like youth are the most important, they're the most powerful voices. We need to meet them where they're at in order to empower them with the right information.
Allison?
Yeah, I'll build on that a little bit. So one source of information or data that I look at in my research is comments that people leave on like news articles. So a Wall Street Journal article or a Washington Post. And I've been looking at some comments on a Wall Street Journal editorial from a few weeks ago, which was, yeah, mostly focused on the measles outbreak. And a comment that comes up a lot is like from either anti-vax or anti-mandate people is like, if you think this is a great vaccine and you want your kid to get it, great. Don't make me get my kid get it, or don't force my kid to get it, which, demonstrates some epidemiological confusion about how measles works, and also some, I don't know, sort of sociological poverty around like, we're all in this together. And I often think adolescents are like, no, like I'm part of this, like I'm part of this community, whether it's HPV or measles. Like what I do is more important, is important to people beyond myself, and creating ways to hear their voices to potentially persuade their parents about vaccination is crucial. And I think that community spirit and community awareness is stronger in adolescents than in either little kids or adults.
Céline?
Well, I agree with that. In fact, I think that's the moment in your life when you're most worried about your peers, right? And so I think it's an important emotion, sort of point in development to be leveraging. I also think teenagers tend to be more idealistic. They're fearless in a way that parents and adults are not. And so, I think they're much more likely to go out, and whether it's to protest or to speak up or to organize. And so that's something we should definitely be leveraging. Um, Also going back to my time working in Southern Africa, a lot of the work we did to educate families about HIV and TB and why it was important to get tested or screened, and here are the symptoms that you should be on the lookout for, that sort of thing. A lot of that was actually done through kids and educating kids at school, giving them stuff to take home. And then the parents, we would end up seeing the parents coming in for testing or whatever other care. And so I think sometimes we underestimate how important a role even young kids can play in educating their families.
Great. We've already gotten a couple questions in the chat, so I want to be respectful that people are putting questions, I guess, technically in the Q&A function. And please continue to add them, and I'll try to get to as many as we can. So here's a question from Sunil. Vaccine misinformation doesn't just affect patients. It's also present among healthcare providers and others working within the system who are trusted to guide decisions. How can we effectively educate the messengers themselves, and what role should public health play in supporting and influencing, trusted voices? So I see you're all nodding. Maybe Alison, I saw you nod first.
Okay.
So you started.
I do think that's a problem, and I think two other problems with providers is their lack of confidence in doing vaccine counseling, and their lack of strategies, evidence-based strategies and tools to do that within the constraints of a really short visit where they often have to do a lot of other things. So I think we've heard a lot from the nursing profession about, vaccine hesitant nurses who don't necessarily recommend the vaccine for their patients. But where my research is going, and others too, are really focusing on, in a short conversation, like, what information do I need to get from this parent or this teen about where they are? And then how can I sort of quickly provide the right, oh, great, no problems, good, let's go get vaccinated, or oh, we need to have a conversation now. What's the best way to sort of build trust or hear your concerns or get you the right information if it is an information deficit? So I think the attitudinal problems are huge, but also we need to focus on giving providers tools to do that counseling effectively and efficiently.
Great. Céline?
Yeah, I mean, unfortunately, some of the biggest spreaders of mis and disinformation, whether it's about vaccines or, any number of medical issues, are themselves physicians. And they're often not experts in the particular space, but they have an MD, which then gives them credibility on any number of issues. There have been efforts by state licensing boards, the ABIM, American Board of Internal Medicine, and others, to try to figure out how to address that, because this is a professional issue in terms of professional ethics. And then I think the other piece of that is, as Chelsea and I know have talked about this before, there is a very real business model behind mis and disinformation. And what is the motivation here? There's a doctor, just one example, Dr. Joseph Mercola. There's been a number of profiles about him in the New York Times and elsewhere, $100 million business based on this stuff. And so it's going to be hard, right, to take somebody to take that person down, to get them to change their minds, because they're very invested, right, in even if they don't believe it, in propagating those myths. So I think it really depends on the situation, what tools you're going to have to respond to that.
Joelle, anything to add?
Yeah, seconding all of that. I think for me, especially when it comes to other providers, excuse me, it starts with starting with empathy and not making assumptions. And because even amongst professionals, misinformation, as we're talking about, can take root. Not always because of a lack of education, but it could be information overload or burnout or systemic distrust, a whole bunch of things that could happen. But to fix that, I think we need to be trying to equip trusted messengers with trusted tools that we know work. I feel like, I mean, just as a recent medical graduate, I feel more confident talking with my patients when I'm most up to date on the latest evidence, where I know that it's correct, where I feel supported in conversations with a hesitant patient, when I'm clear about how to address their concerns. And so giving those tools for how to do that. And public health can support that by offering bite-sized digestible info sheets. Things like that are really helpful. Right now, I've been working with the World Health Organization through Operation FIDSA, which is a collection of healthcare leaders that are both doctors, nurses, researchers, etc. And they provide us with great information from trusted sources about how to talk about things online. It's made me feel so much better about talking about really complex topics or just emotionally charged topics. Facts guides can be really helpful, or even training sessions as well. And then lastly, I think earlier this week I was speaking at National Public Health Week at George Washington University. We were talking about the problem with public health in the fact that it's a faceless organization, that you have this faceless entity that's not really positioned as a partner, but more as a policymaker, telling everyone what to do. I think the more we're able to use trusted messengers, the more we're able to connect people, so that it doesn't feel like a faceless bureaucrat making a difference, but it's a direct individual that's providing and co-designing communication efforts with healthcare leaders, the better we'll be able to make sure that we're getting information that's accurate out there and providing providers template, I guess, in order to talk with patients and guide them to what they need to know to make the best choices for their families.
I think any of the questions that have now appeared kind of could be good segues from that. But one actually comment that I think it's important to share is from Tori Shaheen from NH, which I assume is New Hampshire, but I'm sorry if I'm getting that wrong, Families for Vaccines, saying, she appreciates the discussion and explaining that a lot of their work is actually working with state legislatures to help state legislatures understand kind of what the science says. And also, as Joel mentioned earlier, that the science can be evolving, that kind of they're very clearly on the side of evidence-based legislation and opposing any that is based on misinformation. And what they've really found to work is helping to explain to state legislatures how much it costs to contain outbreaks versus the cost of establishing free or low cost vaccine programs and then supporting them. I wonder if any of you want to share any work that you've done that you found to really resonate either with like local elected officials or at the state level or even the federal level.
Give a really brief example. So there's a lot of activity in the state policy space around both the content of our school mandates and then the exemptions that parents can get from those mandates. And back to Joelle's points about storytelling, legislators are humans too, and they are very susceptible, vulnerable to powerful stories, but also very responsive to them. And I think we're doing some work to think about how to create the stories that support mandates and more narrow exemption definitions, because they will hear a lot from the other side. So thinking about evidence-based ways to tell stories, get attention from policymakers, and really help with the policy formulation process, that is way easier than trying to sort of backstop and fill, for example, a whole state that now has like zillions of exemptions from school mandates. So taking our advocacy and our behavioral science upstream, and trying to be as active in the policy formulation space as the other side is.
Joel or Céline, anything you want to add? Also, don't feel like you have to. No, okay. We have a few questions here, which I would appreciate actually all of you weighing in on that relate to kind of the language and the terms that are being used when talking about vaccines and vaccine confidence. Like, does it matter if you talk about with hopefully forbearance and grace from the different people who ask these questions? Like, does it matter if you talk about vaccines or vaccinations or immunizations? Does it matter if you use like anti-vaxxer, vaccine hesitant? How do you think about these words and when to use them, how to use them? Or are there better words that maybe you all have found, to Joelle's point about really building trust or kind of anchoring in stories or kind of the demonstration of kind of empathy and listening that Céline talked about? So what do you all think about language and kind of what words do you think are appropriate and in what settings and in kind of for what audiences? Céline, Joelle, please go.
Sorry. Yeah, I was gonna say I can kick it off because I think a lot about this when it comes to social media. When I post my videos, I only have 30 to 60 seconds. And so I'm super careful about the words that I use and how I position people. So one thing I do is I use person first language. And so instead of saying anti-vaxxer, I'll say something like people who are hesitant about vaccines, really removing a label to understanding and inviting people into dialogue rather than being defensive. I also try and emphasize things like vaccine confidence over vaccine hesitancy. So how do we build vaccine confidence as opposed to combat vaccine hesitancy? It's you're giving something instead of taking it away. And it's framing it around empowering informed decisions instead of just correcting misinformation. I also really like to use like value-based messaging. And so things like talking about protection and care, community, safety, trust. These are words that we have positive associations with. And the more that we can lean into something like vaccines help protect what matters most, our kids, our friends, our community, or saying things like people may have questions, but our goal is to support your decision with reliable info. All those types of things are things that are inviting in for other individuals, show that we care about how people are thinking. There's a lot of things I try and avoid too. And so anti-vaxxer, like I know that's really common out there, but I try not to say it actually, just because it can turn off a lot of people suddenly if you're just labeling a group. I try and keep out things like misinformed, or ignorant. I think oftentimes when we're in medicine, I talk about the curse of knowledge, where we get all this information, but then we forget how to share it with other people. But we forget that we were at that point at some point too, where we didn't know how to do it. And then I also try and kind of cut out things like conspiracy theories or even convincing or persuading, because really what I'm trying to do is just support and make informed decision making. So those are all things that, as I've been writing just scripts, like I've actually made that conscious change to make it a little bit more available and accessible to different communities. And I've noticed a difference in the way that people will comment on my videos saying, well, I've never thought about it this way, as opposed to saying, wow, are you just calling me out because I don't agree with you?
Mm-hmm. Mm-hmm. Couldn't have said it better myself.
Totally. I have nothing to add. That was brilliant, Joelle.
I
You just wrote the playbook on vaccine communication.
I do though, and I don't know if this is really, Alison, for you with kind of the behavioral science lens or Céline or Joelle, when you're seeing patients, I do though want to make sure, because a few people asked about the language around shots versus vaccinations, immunizations. Like, do you have thoughts about that specific kind of set of words? Because I think, Joelle, you did answer, and clearly with great kind of approbation from your fellow panelists, kind of the first part of the question, but since that was specifically asked, I just wonder if you have any thoughts to share there.
It makes me wish we had the word jab, which is used in the UK. I think jab is great. It just sounds like
Better?
mosquito
That's so
bite or something.
Is there actually science on that, Alison? Because in some
I
ways, like
don't
jab
know.
feels more violent to me. So I don't know.
More than shot? Okay. Maybe because it's just so easy and fun to say. Someone should do that study on jab versus shot.
If only we had someone who was a behavioral scientist.
Oh, shoot. Wait, is there a behavioral scientist in the house? Yeah. Okay. I'll get on it. I also want to evaluate all of Joelle's videos.
But I do think like, it's okay if like you don't have an evidence-based answer, but even like a gut. So Alison's gut was like she wished we had jab, which we don't have in our kind of American nomenclature, at least not yet. But Céline or Joelle, do you have a kind of gut reaction there?
I don't love shots. Between vaccination and immunization, I don't know. I don't know that there's good science on this. I think Alison needs to go do a study for us.
Yeah, I'm not sure either. I'm trying to, even like my gut feeling, like, I don't know. I'm trying to think about what some common terms are that exist. Like shots are just familiar. We know what it means. Vaccination is scientific. It's understood. Immunization, but all of them, I don't know. That's why I really like to use other words like that aren't even like protection or getting vaccinated, community, but it's hard. I don't have I'm not leaning one way either. So I'll have to go back and think about that.
Yeah,
We'll do the study all together.
Okay.
well, and I'm sure the audience joining us appreciates the humility, right, around like what we don't know yet, and kind of then hopefully that makes it clear that we do have confidence in kind of what we know, but also we're aware of what we don't know. There are a few questions here that really are around schools and around like, do you have good recommendations for curriculum in schools to talk to adolescents directly? Some are about, are there good resources for school nurses? Because school nurses are often such trusted parts of a school community and then the broader community. Are there any reflections you want to offer, or suggestions you want to offer on kind of the school curriculum point or kind of supporting school nurses point?
Some of the support for school nurses is a bigger issue, and just a whole lot of schools don't have nurses. And because they are particularly a point of communication with parents around this exemption issue, their child, just having nurses in schools is huge. But I also really liked your point earlier, Chelsea, about just like this could be part of the curriculum. Like this doesn't just have to be about, healthcare delivery at these certain points, kindergarten and 7th grade usually. But what do kids learn about the biology and vaccinology and sociology of this issue, so that the groundwork is laid. And I also think consistent messaging, within a school or a school district, if nurses can sort of support, like, we're person first centered here, or person first, or we're a resource here for you to talk through this with us, that's delivered consistently, can really help with the trust.
Céline or Joelle, any other thoughts to add?
I mean, I suspect this is quite political in certain places, as is all school health, whether you're talking about reproductive health or vaccines. One of my sisters works in a charter school system in Texas. Some of these conversations are going to be very challenging. which is another reason if they're led by the students as opposed to staff, you might actually be more successful.
Well, and I would say Unity actually has great resources for supporting adolescents who want to be peer-to-peer educators and kind of one-to-one. And I see even Judy like popping back on the screen, and even Joelle, I think they do have, because I know you made sort of an earlier point about like, combating misinformation and building kind of, evidence-based information into group chats. I think they also have kind of suggestions on how best to do that. I don't know, Judy, you just popped on screen. If you want to add something, please do.
I just want to say I love the fact that you all are talking to the adolescents and agree with everything you're saying. Just from all of our research and our discussions, they are so powerful in educating their families and their friends, and want to do the right thing. We're actually, Chelsea, putting forth a commitment to action application to try to get to support teens across the nation to be trusted community messengers. And, we feel like that is, Céline, as you just mentioned, a path forward that is acceptable and, is proven. So very excited about the points you all bring up. Thanks.
That's great. Someone just added in the chat, a school-age person made a poster for the COVID vaccine clinic that said, "It's no joke, get the poke." So maybe, Allison, you could add poke in too to one of the terms that you evaluate. And I love the creativity of kids, and agree, Joelle, we always should be in a posture of kind of co-creating and learning with and from youth. A question we haven't touched on yet, that I want to be sure that we get to, says, I'm an immunizing pharmacist who battles vaccine hesitance on a daily basis. How can experts like all of you help advance pharmacy-based vaccination and combat different barriers, like allowing pharmacy technicians to vaccinate in more states? And just broadly, what advice would you have for pharmacists who kind of are on this front line? Alison, I see you nodding most emphatically, so we'll start with you. And
Maybe
then
I'm just an emphatic nodder in general.
Well,
So we
wow.
did some work on this before the COVID pandemic, just about like pharmacies as a site of immunization. We were mostly focused on adults because back then there was almost no childhood vaccination at pharmacies. And there are both like supply and demand issues here. One interesting thing is how much face time do pharmacists have with their patients / customers, and that really varies by the pharmacy setting and the staffing. But there was also this interesting perception, and it would be important to see if that's changed at all, because so many people got vaccinated at pharmacies during COVID, and I think that's stuck a little bit. But there was this interesting perception that the vaccine you get at a pharmacy is like lower quality than the vaccine you would get at your doctor's office. We didn't have a chance to explore that, but I think phenomena like that are really interesting to sort of unpack as a barrier to even seeing a pharmacy as a place where you would get immunized. But again, the same toolkits that we say school nurses need and providers need, pharmacists and pharmacy staff need as well. Even as like here, you're picking up your blood pressure medication. Hey, did you get your flu shot? I can do that for you right now. Just making it sort of easy and seamless, and seems like the default and the norm, so that you leave with your blood pressure medication and your flu shot.
Yeah, I think one of the questions was really about scope of practice. And so that's, at a state level. So that would be something I'd be working with your professional organization to advocate for expanding the scope of practice to allow for that. So that's going to vary state to state. In terms of the retail pharmacies, some have been very successful. CVS, for example, in sending out text reminders to people of, oh, you might be due for your Tdap or your flu shot, or we have a COVID vaccine waiting here for you. Saying that there is a dose reserved for you has actually been very effective messaging as well. So I think, you have the pharmacists and then you have the retail pharmacies, each of which have a role to play there.
Yeah, I want to second that point of messaging, because I think messaging is really important in a case like this. And so I think it comes from telling the stories of how pharmacists make an impact. I'd say focusing on rural and underserved communities that don't have necessary access to these places. It could be making sure that pharmacists are included in public health campaigns. So it can be working with groups like the APHA to make sure that conversations are held that are there. So then also advocating for policy change at the same time. And it can even be just working with media and legislatures to make sure that you're framing the pharmacy not as an alternative, but as a solution. And so making sure that, like, for example, like one of the things I actually was talking to one of my friends about who's a pharmacist, that pharmacists are literally the most accessible healthcare professionals in the US, if you think about it. They're available on the evenings, on the weekends, when no other provider is. And so I think framing it in ways like that to show why it's important and why it's necessary are ways to change the messaging of the system and make sure that people trust pharmacists in the same way. And then as Alison, you were saying that you found that people weren't trusting in the same ways when they got it from their doctor's office. So try and flip that script.
I also noticed, I mean, I think some system integration can really help. So if I get a vaccine at CVS now, it goes into my medical record with my primary care provider. It's just seamlessly, it just happens. They're like, oh yeah, we saw you got this vaccine at CVS. And that makes it super easy for me to like not have to think a lot about, do I do pharmacy or doctor's office? I can do whatever's most convenient,
So
which is super important for adolescents.
just jumping in real quick on this, based on our surveys that we've been doing with parents and teens, Alison, to your point about where they're comfortable getting their vaccines, physicians are number one, but pharmacists have dramatically gone up in terms of where and who parents and teens are comfortable going to since the pandemic. So that is based on kind of quantitative survey research. So I just wanted to jump in with that.
Speaking about quantitative research, there have been a few questions in the chat around really honing in on what evidence do we have about what reduces vaccine hesitancy, and kind of what is the dose response of like what works the best. And so wonder, Alison, since I know you've done a lot of this work, if you can jump in here.
Yeah. And there's so many like systematic reviews and evidence synthesis about all of this. I think at least I'll speak from the behavioral science community. I think we were a little humbled during COVID. We were asked by many, many policy audiences and practice audiences, just like, tell us what works. Like, just give us the 5 things we can do. And of course, what we said is like, well, there's 15 things that could work and they might work differently. And will you let us do a randomized trial? And they were like, no, like we got to roll out this vaccine now. And so I think there's been a lot of reflection on that about like, could we really distill it down to a few things? I think one top line thing to recognize is that it's really different to try to change someone's like motivation or intention versus try to just like help them get vaccinated once they have that intention. So being precise about what kind of recommendation or program I'm offering is important. And then I guess the one other thing we just know works is if you make it easy. Whatever that means, financially easy, logistically easy, time, perception, you make it easy for this behavior to be consistent with my identity when maybe it's not. And those are easier interventions to put in place than like really heavy lift, like let's build trust. And those are just harder, longer, more sustained things. But if you can make something easy for someone, it's much more likely to happen.
I'm mindful we only have like a handful or so minutes left, and I want to be respectful of, thankfully, all the people who are now adding questions. So there are a few questions, or one comment actually, and a few questions around the inherent challenge of talking about vaccines, because they do work differently, right? Different vaccines work in different ways, and so one person says, it's hard when people don't feel great after they get the flu vaccine, to help them understand that flu vaccine works in one way, but other vaccines work in another way, or to help parents understand maybe why their kids get a vaccine at one time, but not another, and then a different one at a different time. And so you wonder, I see Joel, you're nodding a lot, and Céline, you too. So maybe Joelle and Céline, and then Alison, if you want to jump in. How do you try to help people understand there are differences, and we don't need to be scared of those differences?
Yeah, I mean, I'm nodding so much because I remember when I got to medical school and I was learning about it in my microbiology class, I was like, oh my goodness, there's still like, I didn't realize that vaccines were also different, like, and as you were going through it, you're starting to learn the reasons why and how they work differently. But I think like stepping back and just like looking at it as a humble human and not realizing there's so many differences, I can understand the fear of that. Of when you're hearing about something like the measles or like you're mentioning as the flu vaccine, and you're not real, or the COVID vaccine either, you're thinking that vaccine more broadly means all the same thing, when in fact it doesn't necessarily. And I think it goes back to what I was saying earlier about making sure that we tell people that one, science is still changing, but then also two, exactly what you just said, that there are differences in different vaccines and the way that they work for different reasons because they treat our bodies differently. I think leaving it very simply at that, but then saying, I'm happy to answer any questions about how this works differently from the other ones, and leaving an open door to have those conversations. To your previous point about what works effectively when it comes to reducing vaccine hesitancy, I think a lot about like motivational interviewing too. And so encouraging them to think about what are the reasons for one to get vaccinated, especially in one-on-one settings. I think that can help in this exact way too. I mean, I think one thing we haven't talked about, but I think about a lot, is avoiding myth repetition. And so not repeating misinformation if we're trying to debunk it, because that can make it stick in someone's memory more, but instead leading with the facts and only mentioning the myth in like a truth sandwich form. So saying the truth, briefly acknowledging the myth, and then reading the truth. I think even when it comes to things like talking about how do different vaccines work for different conditions, that can be really effective as well to combat misinformation while also acknowledging that they have those worries.
Céline?
Yeah, I will say this can be very challenging. Even infectious disease doctors who I work with did not understand some pretty basic stuff about immunology. For example, incubation period. So if you have an infection that has a very short incubation period, it is next to impossible to vaccinate and prevent infection, because by the time your immune system kicks in, the infection has already started to take off. That's in contrast to, for example, smallpox or measles, which have very long incubation periods, as opposed to say COVID and flu, which have very short incubation periods. So when you have an infection that has a long incubation period, you can even vaccinate after exposure and prevent them from getting sick. And it's also why smallpox was an infection you could eradicate. Now, measles is not, for a whole bunch of other reasons that we could get into. But, again, even my own infectious disease colleagues could not understand some of these things. And so I don't necessarily think I can, my goal should be to have the lay person understand what even a specialist can't. But I think being available to ask questions or answer questions, and uh that there is no stupid question, because as I said, like even my colleagues don't know these things. I think that's really how I approach it.
Again, mindful we're sort of in a race against the clock. I want to acknowledge a lot of the questions on the importance of showing up at state legislatures, that when parents show up, when school nurses show up, to be pro-vaccine, to be kind of, as Joel was talking about, kind of on the affirmative side instead of just counter the negative, that state legislatures generally listen and that it is effective, and also stressing the importance of continuing to show up, because certainly those who do not support vaccines or vaccinations, they think often also for their own self-interested reasons, as Céline was acknowledging earlier, are always there. So I think that's important. Also, a lot of questions really echoing kind of where Joelle started, of the importance of co-creation, of whether that is co-creating with adolescents when kind of we're thinking about something like the HPV vaccine and how to kind of spread awareness about yet another extraordinary kind of medical achievement, at least if it's one that we all take advantage of, to during the Mpox outbreak, all of the co-creation work that was done with gay and bisexual and other men who have sex with men, to really kind of quite literally meet people kind of where they are so that they could access the information that they needed to then make the right choices to keep themselves and their community safe. So just, we've gotten lots of comments and I didn't want to not acknowledge all of those. I would say the last sort of big kind of bucket of questions that we've gotten really have related to something that we've kind of talked around but haven't addressed specifically. So in our last few minutes, just want to be respectful of a lot of the people who ask questions in this area, which are around school vaccine exemptions. When people are really trying to figure out, even just as like citizens, do they support them? Do they not support them? What are the differences between different kind of exemptions? Because we know that's different in different states. How do you kind of call out the people who seem to churn out the kind of medical exemptions, where it's not possible that they would have seen like all 100 children they may have written a medical exemption for, while not in any way casting aspersions around why some of the people may have wanted them, but calling out the doctors who may be doing it for their own purposes. So lots of questions in there, and we probably can't answer all of them, but just want to be, again, respectful that a lot of questions were also asked about school exemption. So Alison, I see you not, maybe you just are the great nodder. I don't know. I see you nodding. So maybe also we start with you, and then also Céline and Joel, please.
Yeah, I mean, mostly I would say we need a whole nother hour to talk about this, and it is going to be a very active space of legislative activity. The only thing I will say is we don't do a good job of talking about freedom from and freedom to enough in this space. Parents want freedom to decide about their vaccines, but we would also like freedom from these infectious diseases in our schools. And the other thing I'll say is we know from there's evidence that more liberal exemption policies lead to more exemptions and lower coverage and more disease. That's very demonstrable for measles and pertussis. And the exemption environment or regime in your state is also a signal to parents about the importance of vaccination. So we sort of forget about that feedback. If like my state says, you know, these mandates aren't a big deal and it's really easy to get out of them, that is a signal to parents about how they should be feeling. And we need to keep that in mind.
Yeah, I
Joy.
think what you just said about freedom from versus freedom to, I mean, that's actually a big distinction between American culture and European culture, right? And how our Constitution and so on is written. We are very much about freedom from. They are much more about freedom too. So freedom to have food, freedom to have housing, freedom to have, and it is a very different kind of framing. But I think leveraging the word freedom to the degree that we can, that is a very American value, but perhaps reframing it a little bit to the degree that we can. You know, think about the immunocompromised child for whom they actually cannot get a measles vaccination because it's a live virus vaccine. The only way to protect them is for everybody around them to be protected. And so are they free to participate in, I don't know, school sports, or what are the things that they might not be able to do because others are not getting vaccinated or taking other precautions? I think that is a powerful argument.
Joel?
Yeah, that's such a complex issue. I think Dr. Gounder just talked about it a little bit, but the fact that they exist for the rare situations when a vaccine really isn't safe for someone. So like a kid that has severe allergies or is immunocompromised for cancer treatments. But when those exemptions are handed out in bulk by providers without valid reasons, it undermines the entire trust of the system. And it creates unfairness in public health and puts vulnerable students at risk. I think the more that we frame it like that and that collective community mindset, I think the better we're able to move into an area where hopefully people understand why it's necessary. But I think it's difficult. But I think using policy data as well to back up how that shows it as well. So for example, if 1% of students should qualify for medical exemptions, but then after stricter exemption laws pass, more people are getting it, that suggests abuse, not a sudden health crisis. And so really making sure that we frame it as a way to say that this is something that's protective to our communities. The medical exemption should be based on science, not just preference. And that when exemptions are misused, it puts other children with real health risks in danger.
I know we're out of time, but I do just want to share the first comment we actually had in the chat was from a doctor here in New York, where I live, who said they'd heard through their adolescent medicine network that many adolescents and young adults have come to their doctors during this recent measles outbreak just to check if their parents did vaccinate them because they wanted protection for themselves and others around them. And I just think that is the perfect note to end on before I hand the floor back to Judy.
Thank you, everybody. And it's been just such an interesting and productive conversation. So thank you, Chelsea, Joel, Alison, Céline. We all know vaccination is critical to staying healthy. And, we're all in the fight to get credible science-based information out there. Please go to Unity's website and check out all of the AIW resources. And please do complete our brief survey so we can continue to bring you such interesting conversations. And the webinar will be available on Unity's webpage. So again, thank you so much for all your dedication.